Hi, my name's Emmy and I'm a personal trainer. In this video, I'm going to talk you through how to do a pelvic floor contraction. So pelvic floor contraction is one of the first things you can start doing immediately after giving birth. It's very safe to do, unless you have some contraindications to do with pain or issues with your pelvic floor that has already been identified, in which case I would urge you to consult with a physio or your obs and gynae before doing the contractions. However, the pelvic floor contraction for most of us are perfectly safe to do and very much a foundational skill to learn in order to take up exercise again after giving birth. So we will do it seated initially. It will be easier to feel your pelvic floor in the seated position. You can also try it lying down or standing. Standing will be the most difficult position in which to really feel your pelvic floor. So I would recommend either doing it lying or seated like I'm doing right now. Okay, so there are several muscles that make up the pelvic floor, and we're really trying to engage all of those muscles all at the same time. Okay, it's a very important set of muscles that are there to hold up, like a hammock really, at the bottom of our upper body and the torso, to hold up the internal organs. Okay, these are the muscles that activate when you're sneezing, coughing, laughing, etc. You may have found, if you're immediately postpartum, that those muscles are not really working as they should. This is quite normal immediately postpartum, but you don't want it to continue for a long period of time. And pelvic floor contractions are the best way to rectify this. Okay, so firstly, I'm going to have you think about contracting the front part of your pelvic floor. Now, when we think about pelvic floor contractions, I think this is the muscle that most women end up contracting almost in isolation. So firstly, we want to feel for that on its own. And so the way to think about activating this muscle is activating the same muscles that you would use when you're trying to stop the flow of pee. Okay, so I want you to always do this on your breath out. So let's do this one together. You're going to breathe in through your nose, like the 360 breathing, and then on your breath out, you're going to squeeze your peeing muscles. And then, very important that you relax those muscles afterwards. Don't keep them contracted all throughout this exercise, okay? Let's try and do that again. You might find that you can contract initially and it starts to let go, the endurance isn't so great, or you might find it's able to hold on in terms of the length of time, but maybe the strength isn't feeling so strong as you might expect. All quite normal, and these are all things that we can correct with pelvic floor contractions over the course of time. So let's do the front, so the peeing muscles again. Breathing in through your nose, relax the tummy, and then breathe out. Pelvic floor contraction. So you should feel that pelvic floor contraction as being more at the front of your pelvis. Okay, so let's sort of say that this is the front part of your pelvic floor. Next, I want us to focus on squeezing the back part of our pelvic floor. Now, the best way to imagine activating this muscle is if you were trying to hold a fart in, and you would squeeze that same muscle on your breath out like we've been doing for the front, the peeing muscles. Okay, so you're going to breathe in, breathe out. Now, how did that feel? You might find that the front versus the back, they don't feel exactly the same. Maybe they don't respond the same. The power isn't the same. The endurance isn't the same. All quite normal, but do try to take a note of how they feel, okay? And we want to try and improve all around both the strength and the endurance of the pelvic floor muscles. So that should have felt like it was coming more from the back of your pelvis. Okay, let's do that one more time. So you're going to contract on your breath out. So breathing in, and then the back of your pelvic floor, breathing out. It might also be difficult to know if you're really able to contract, but that's okay. All of these things are quite normal in the beginning when the muscles have been under pressure for a long time with baby sitting on it, and then if you've given birth vaginally, you would have lost a lot of strength in your pelvic floor. So don't worry too much if you can't really feel right now exactly the front, back, is it on, off, but the main thing is the mind-muscle connection. So you're really thinking about recruiting those muscles as you breathe out. Okay, and over time, like any muscle, when you train it enough, it's going to get stronger. Now we're going to try to recruit the side of the pelvic floor muscles. Now this one is going to feel a little bit more nuanced. It's not going to be so easy to feel if you've contracted them. You're going to imagine the seat bones, so the bones that you're sitting on now on a chair, that those two bones are pulling slightly towards each other. They don't actually pull together, okay, but you're going to imagine that you're pulling them together, okay, and that will help activate the sides of the pelvic floor muscles. So let's do that again on the breath out. You're going to breathe in and then breathe out. So it's a little bit more difficult probably to feel. These aren't muscles that we're used to using really so much, okay, on a day-to-day basis. You might also feel one side feels a bit more stronger than the other, vice versa, all normal things. But I would like you to start being aware of how it feels when you're trying to contract, and then you can kind of track your progress as you improve through the course of time. So a pelvic floor contraction is when we recruit all of those muscles, the front, back, side to side, all at the same time on your breath out, okay? So try to bear in mind the muscles you're recruiting for the front, the back, side to side. We're gonna do it all together on our next breath out. So breathing in to prepare, and then you're gonna breathe out. Now, did that feel any different than the first few breaths you had done? I think so. You should probably feel that it was more of a stronger contraction. The best way to imagine it is if you imagine you have a tissue that's laid out in front, under you in the diamond shape. So each of the corners are one of the areas of the pelvic floor muscles, the front to back, the side to side. And you're going to imagine with your pelvic floor, you're picking up that tissue from the middle. So I find this is the best way to really try to describe how it should feel. So you should really feel that it's lifting up as you breathe out. So let's try that one more time. Breathing in and breathing out. So there we are. This is how we do a proper pelvic floor contraction. And like I say, this is one of the most fundamental skills to master before moving on to exercise. So do give it a good amount of practice in various different positions before you attempt anything intense in terms of exercise. If you are experiencing problems, if you're getting pain, if the dysfunction is not getting better, please consult with a medical professional.